Today we've got Pav and Stuart, the dentists who I graduated with at UCLan, and they're going to be helping us look at a personal statement today. Actually, two versions of a personal statement, the first early draft and then the final draft of that personal statement. So just giving all of you an insight into how dentists would read a personal statement and how it would come across to dentists. Obviously, we're not admissions tutors, so just have that and bear that in mind. But it just gives you a flavor of how a dentist would look at your personal statement. I mean, for myself, one of the things that helped me was the fact that on work experience, the dentist actually offered to look through my personal statement, and she ripped it to shreds. And that was good because it meant that I was able to work on it a lot, and it allowed me to then get a place at dental school. Maybe Stuart and Pav, if you just let us know what you're up to, what you're doing. If we start with Pav.
Hi Arnold. So currently working as a general dental practitioner. I do 3 days privately and 2 days NHS, so I get a good mix. And I also studied with Arnold, so about 3 years now since we've been doing this. So yeah, that's pretty much it.
Where did you do your first degree?
I did it at King's. I did biomed first, and then I did graduate entry dentistry at UCLan.
Awesome, awesome. So Pav's getting stuck in with NHS and private dentistry there. How about you, Stuart?
So I'm Stuart. I'm a dental core trainee. I'm currently working at Alder Hey, which is a kiddies hospital. So I'm doing the max fac side and some of the dental side at Alder Hey Hospital. So duties include, well, basically taking lots of kiddies' teeth out, but also managing sort of paediatric trauma and paediatric emergencies. So the experience at the moment, perhaps a little bit different to what Pav's doing at the moment.
Awesome. And what were you doing before as your first degree?
So I did medicinal and biological chemistry, and then again went on to do graduate entry at UConn and studied again with Arnie and Pav, and we were both in, well, all three of us were in a little group in Blackpool, so quite close friends after it all.
Awesome.
Best group.
Yes, Blackpool Deck is the best group at UCLan. So we'll get straight into it. What we're going to do, we're going to look at the first draft, or one of the early drafts of this personal statement, and Pav and Stuart will just take it in turns to comment on what they think, and we'll just do it paragraph by paragraph. Let me just get the screen up, so the draft, and then maximize that. So can you guys both see it?
Yep, we can see it.
The one that says early draft.
Yeah, and that's fine. You can see it.
Stuart?
Yeah, I can see that as well.
Okay, so we're just reading the first paragraph. It says, dentistry is a dynamic profession, combining cutting-edge science with patient care. My ambition is to become an NHS dentist with an active role in the community. This desire stems from my parents who have worked for the NHS as nurses, and their direct involvement improving people's quality of life has inspired me to apply my abilities so that I can help others. This led me to undertake a week of work experience where I had the opportunity to shadow a maxillofacial surgeon for a day. And this is where I first became fascinated by dentistry. So one of the big things about personal statements is people get really caught up about the intro. What do you both think about this intro?
Well, I think the good thing about it is quite sort of introspective and personal straight off the bat. So you're talking about obviously how his sort of parents have inspired him. I think the first line's a decent opening in the sense of it introduces everything quite well. So I think overall it's quite a nice introduction. A couple of early criticisms, I think it's quite wordy. Is a little bit of waffle, I think, sort of. You could definitely cut out a number of words and make it a little bit more concise. And then I suppose the only other criticism I probably have is to do with the last line about maxillofacial surgery. I would probably be a bit more specific. I think just saying becoming fascinated by dentistry and specialist equipment is perhaps a little bit vague.
Yeah.
For the people listening, maxillofacial surgery is a subspeciality of dentistry, and I think if you're going to highlight that in your personal statement, you should perhaps say something that's specific to MaxFax. You could talk about surgical extraction of teeth or management of trauma or something like that, rather than a quite unspecific and a little bit of a vague comment. I think just to the people reading it, it would show that you've taken a little bit more on board from your work experience. So that was mine. But overall, a good start.
How about yourself, Pav?
So I had made the same points as what Stuart said, really, that definitely like the fact that it's really personalised, because I knew that was like quite a big thing when we were applying for unis, that, you know, this is your reason for being a dentist, so make sure you put that in there. And I think relaying that back to the parents is really nice. I also did find the last sentence a bit vague, so I guess that we both thought that. Generally, I liked it. I do think maybe mentioning the work experience is a little bit too early on, like structure-wise. You could probably do that later on. But if that's his reason why, if that's his why for doing dentistry, then it does need to be like a little bit more specific.
Awesome. Okay. So if you're to score that out of 3, let's say, 1 being terrible, 2 being okay, and 3 being amazing, what would you both give it for an intro?
A 2. Low 2.
I'd give it a 2.
2. Okay, let's see. So there's
I
some
think
things that can be worked on. Sorry?
Yeah.
That's it. I was just about to say the same. It just needs a little bit of work on it, really.
Yeah, it just needs refinement, doesn't it? It's a bit waffly and a bit.
Yeah.
It doesn't read really well.
So 3 weeks of work experience in a dental practice made me appreciate the pressures dentists face, such as working within the appointment times and delivering a consistent service to their patients. I learned the importance of communication during consultations and building relationships with patients, and the significance of a multidisciplinary team in providing effective treatment. For example, in routine checkups, the patient could meet most of the dental staff in order to maintain their dental hygiene. The dentists displayed interpersonal skills continuously as they managed the staff and as they related to their patients. I will start with Pav for this one.
So when I first read this, again, I thought it was a good general paragraph of work experience, but there was nothing very precise in there, again, is what I found. The good points, I'll start off with those. I thought it shows that you have done the work experience and you've talked about the kind of, not negative things of dentistry. I guess it's just part of dentistry, like the pressures that are involved in it. So I thought that was really good, because it just shows that little bit of maturity, that you know what you're getting yourself into. But then the communication, like to mention communication, I think you have to do it somewhere in your statement. But then later on, this routine checkups and meet most of the dental staff, it's really easy, I think, to put in there that, you know, you saw that the dentist referred the patient to the hygienist, and, you know, you can mention actual team members. So I think that's probably where the improvement is. And I know that they always say when you do talk about your experiences to like reflect on them, which I think person you know, probably could do a little bit more of, but generally I just think it's that refinement again, to be more precise.
Okay. All right. And out of 3, what would you give this?
Probably just below a 2.
Just below a 2.
Just below a 2.
All right. Stuart, what do you think?
Yeah. I think it's quite good that me and Pav are agreeing on the same points. I think the writer of this has gone for obviously sort of the non-clinical side of dentistry, like communication and team working and things. Yeah. However, if I was writing this personal statement, I would say sort of 3 weeks of work experience taught me communication, team working, and what other point, and then use specific examples to highlight it. Yeah. I think in this case, it's the thinking, sort of the general idea is good, but the flow of it and the thinking's a little bit muddled. So I think perhaps if I was writing it, make your points at the beginning, clearly sort of postmark them in terms of communication, team working, and I don't know what else, and sort of interpersonal skills, make them at the top, and then highlight it with 2 personal experiences that you've had. As Pav said, if you sort of talk about how a dentist leads a team and then refers on to a dental hygienist, it shows that you understand how a dental practice works. It shows how you understand the different members of the team. And you don't necessarily have to say, I saw teamwork by da-da-da-da-da. If you highlight that obviously the referrals are taking place and the patient's being managed by different aspects of the team, then it kind of demonstrates that you understand the nuances of teamwork in dentistry. So that's what I would suggest.
Do you both feel like this is reflective of somebody that would shadow a dental practice? Would you be able to see if things didn't match up? What I guess what I'm trying to say is, would you be able to tell if somebody had really gotten something from work experience, if they're making stuff up? Do you feel like this is genuine?
I suppose it's difficult to say, isn't it? But I think that's what me and Pav sort of alluded to in terms of being quite specific with the points that you make, because you can only be specific if you've experienced it yourself. So actually drawing on experiences that come to mind help to demonstrate that you've actually done the work experience. Whereas some of the stuff that's quite vague, sort of dentist displayed interpersonal skills, is, to be honest, if someone not involved in dentistry could probably write that down. Whereas if you said the dentist discussed a treatment plan with the hygienist, that's a little bit more specific.
Okay, so you're actually saying what you saw.
I think so, yeah.
Like Pav was saying earlier, you're reflecting on that.
Yeah, because then you're using personal experience and then your own reflections.
Okay. So, I enjoy enriching other people's lives, and this is evident from the various mentoring roles I've been involved with. For example, as a Duke of Edinburgh leader, I managed and supported a walking group for a year as they completed their Bronze Award. Deep breath. Completing all the Duke of Edinburgh's awards challenged me to improve my teamwork and interpersonal skills. For the Gold Award, I had to navigate and camp out for days in Snowdonia, and this was successful due to good communication and interdependence within my group. These are long sentences. Yeah. My teamwork and communication skills have been further developed from my 3 years working as a healthcare assistant. As part of a multidisciplinary team, I ensure that the patient care is of a high quality in order to supplement the beneficial effects of treatment. I also volunteer as a support worker for vulnerable adults with dementia, and in doing so, I've learned to become more empathetic and non-judgmental. So here they're starting to talk about the other things that they get involved with. Stuart, what do you think?
Well, you've alluded to it. It's a lot of quite long sentences. Again, I do feel it's a little bit, I think it's been overpacked, a little bit waffly at times. I think, again, just, it might be just my sort of style of writing with these things, but I tend to just try and make a point. So obviously enriching people's lives, I think that's just a bit of wasted wordage. Just put in, I enjoy doing Duke of Edinburgh, something like that. Yeah. As part of that, I do mentoring roles, and then go on to highlight it. And I would perhaps, towards the bottom, you've done about sort of voluntary work and work as a healthcare assistant. You either want to make a bigger point of that or put it in a separate paragraph, I would say. Specifically the stuff about volunteer work with dementia, I think you could highlight some better examples, because obviously you talk about empathy and sort of non-judgment. I think expanding on that a little bit more would be more helpful. Because again, you're kind of making a waffly point without backing it up with anything. You've got to think, you need to demonstrate to the readers that they think, oh yeah, they are empathetic and non-judgmental, but how? You would kind of assume that someone working sort of with people with dementia obviously are that, but again, maybe not a specific example, but just expanding a little bit more would be more beneficial than just making a statement at the end of a paragraph.
And Pam? Actually, no, Stuart, what would you give it out of a 3?
That one.
A 1, okay. So yeah. Stuart's really saying a lot of work.
Yeah, I think that one's probably the weakest paragraph so far.
And Pam?
So yeah, when I read this, I was like, wow, that's wordy. And I think if that's my first opinion of when I read it and your guys', then you need to cut the words out. The content might be fine, but if the structure is a bit off there, definitely needs to be concise, really what Stuart said. I still like the fact that they've mentioned their personal experiences outside of dentistry. And I think it's really important when they want you to be so well-rounded now, and this person's got a part-time job. I think they've ticked a lot of boxes, but really it's the waffle that's just let it down a little bit. And I totally agree with the last sentence, because I don't know, it just didn't really sit well with me. And it was almost like just the end of like I've had this experience. I'm more empathetic and non-judgmental now. I think it's better to put in, you know, why that's been the case. And the other thing I thought is maybe put something about listening skills, because communication is really big, empathy is really big, but I think like now it's like listen to your patients. And this person being a healthcare assistant has had a lot of time to listen. So I think just like squeezing that in somewhere, but cutting out the waffle as well would probably work quite well.
Just building on what Pav said in terms of the listening, I think another key point is sort of like conflict resolution. Like obviously as dentists, we want to do a bit more of that, but even perhaps talking about a slightly stressful situation as a healthcare assistant. If you talk about a stressful situation, you can get across your communication, listening, conflict resolution. So it ticks a lot more boxes. So you always need to think, and these limited word things, you need to give an example that's going to be like tick, 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 tick.
Yeah.
So the listening, like Pav said, communication and handling pressure, handling stress, conflict resolution. You can see how the reader will be like, oh, yeah, that's more impressive than just saying the empathetic and judgmental things.
So Stuart gave it a 1. Pav, what would you give it?
Maybe a 1.5.
1.5, okay.
The content is there.
Yeah, it's refinement again.
Okay, so let's move on. So cosmetic dentistry has become increasingly popular, and my work experience made me realize our dentists have a wide range of treatment options like veneers, dental implants, braces, and aligners, which allow for the patients to have choice. This gives the dentist an opportunity to discuss and advise the benefits or consequences of each option, and I believe that my explanatory skills make me suitable for this role. Visits to 3 different dental laboratories gave me insight into the process of producing dentures, from recording the first impressions to the fitting of the dentures. This was invaluable insight, as I now appreciate how necessary the close collaboration between dentists and lab technicians is to producing dentures. What do you think? We'll go with Pav.
So when I first read this, the start of it, I was like, oh, they're talking about cosmetic dentistry. I don't think there's anything wrong with that. Yeah. But I think when you're doing dentistry, you should mention, I know they've mentioned the healthcare aspect first, but I just think if you're starting off with dentistry, you do need to put that in there a little bit more. There's nothing wrong with putting cosmetic dentistry, but I'd probably put a sentence at the start saying, you know, dental health is like the most important thing as a dentist to maintain. But obviously, you know, that's not a great sentence, but dental health is so important. But then bringing in the cosmetic side, because I think it is really important. But I just think maybe as a student, you shouldn't go jumping into it. Yeah. I don't know how you guys feel about that. I think it does show a good awareness of the different types of dentistry that you do when you're out there as well. You know, and basically they've just discussed consent as well, haven't they? They've discussed, you know, explaining treatments to patients, which I think is great. The lab part then, it's a little bit off because you're starting talking about experience again. So again, I think it might be structure that needs work on. But then I really like the example they've given. It is specific. But I just think that you do a lot more than dentures with your lab technician. So maybe just mentioning that and then saying that, but my experience was with dentures, and I, you know, saw the whole process from the surgery with the dentist to then like went to the lab. Do you know, like fitting it in a little bit more? Yeah, would be slightly better. Yeah, I don't know how Stuart will feel about the cosmetic dentistry has become increasingly popular, but for me, I just think stick to healthcare. Yeah. And then mention it as like a side topic. Don't make it the main point of the paragraph. Yeah. I think.
Yeah, I completely agree.
Actually, before we move on to Stuart though, Pat, what would you give it out of 3?
Yeah, a 1.5 again.
1.5, solid 1.5. Okay, Stuart.
I would not mention cosmetic dentistry. I think
strong statement there. How come?
Personally, yeah, I just think, especially applying to dental schools who are going to teach you about general dentistry, yeah, sort of pigeonholing your early doors with cosmetic dentistry, it might get some of the people reading it a little bit, not irritated, but a bit like they're only going in it for one thing. Do you know what I mean? So I think dental schools want to produce well-rounded dentists, as Pav said, that are interested in the sort of oral and general health of the patient. So an early statement saying you enjoy cosmetic dentistry, if a certain consultant picks that up, it might irritate them. I think I would change from cosmetic dentistry to just general dentistry. And if you want to highlight the point, you could quite easily put cosmetic. Well, you don't have to put cosmetic dentistry. You could talk about veneers or talk about dental implants. You could talk about dentures. But I agree with Pav. Put something about maintaining oral health.
Yeah.
Well, you can put boring stuff like toothbrushing advice, but it's so crucial. And I think an awareness of that as before starting dental school is very, very, very important, because that's the first things that you're going to learn. Yeah. I think I understand what the writer of this has done. They've tried to obviously link some treatments with the lab, but I think they could be more specific. For example, they've mentioned about veneers. For example, if you change that to sort of crown work, or you could link that a lot better with your work experience at the lab. So you could talk about making dentures or seeing crown preparations in, like Pav said, in the dental surgery, and relate to how they're sort of cast up in the lab. And then you can see how accurate dental work makes the job easier for the technician.
Yeah.
So it's just things like that. I think just being quite specific is important. And I think where it says from recording the first impressions to fitting the dentures, I don't know what point they're trying to make. Are they trying to make the point that they saw the recording of the impression in practice, or are they saying that they watched basically the technician cast up the models? If they could really make that specific, it demonstrates that they've got a reasonable understanding of dentistry before they start. At the moment, it's kind of a bit of muddled thinking. So I think, I know we're coming from sort of 3, 4, 5 years of experience, but I think little words like that can actually make or break a personal statement. I think being very, very accurate in terms of words are important, because it makes you look like you know a little bit more. That's all.
So I really find it interesting, the reactions you both had. And I've got similar reaction with the whole thing about cosmetic dentistry, because it starts bringing up questions of, has this person really considered what the majority of dentistry is about? Have they been sold on the glitz and the,
it definitely
the cosmetic side to dentistry, which is not the majority of dental work? Really, you want somebody to be focused on the health aspect.
Exactly. And if you look at the starting paragraph, sorry, Stuart, the start paragraph is, I want to be an NHS dentist.
Good point.
So then you can't jump in with the cosmetics. I probably hold a different stance to Stuart. I think you could mention it briefly. It's everywhere. Everyone knows it's everywhere, and that you'll be exposed to it. But I don't think it should be called cosmetics. Like crown work can be classed as cosmetic, but it's an essential, thing that we do as well. So fit it in that way instead. The other point, I don't know, I just realised was they do mention the amount a lot, and I don't know if that's very important. Like 3 different dental labs, I visited 3 weeks of like shadowing in a practice. The 3 different dental labs, I agree with Stuart there. Like put something very, very specific then, and then it shows that you've actually learned something from the experience.
Yeah, because at the moment they're going for quantity sort of rather than quality. Because so far with the work experience stuff, I'm not 100% convinced they've picked specific stuff up. They've kind of said, I've gone to a dental lab for 3 weeks and saw a denture get cast up, which it's not that specific, is it? Just say something a bit more. I did have a point, but I've forgotten it. So that's that.
Okay, so here, be clearer, be careful if you're mentioning cosmetic dentistry.
I would emphasise the point. I don't think I would mention it. I think it questions the motivations of getting into dentistry.
Okay.
And I think from experiencing people, I think knowing dentists who read this would get a little bit, not annoyed, but they just be like, their motivation is to get in it, earn a load of money, and not help people. So
and this is good because you're getting to hear how different dentists would view this sort of personal statement. And our thoughts are not going to be exactly the same, but it's interesting to hear the different viewpoints as well. Okay, so next paragraph. My ability to learn autonomously is evident from secondary school, where I gained the GCSE award for being the top ICT student. However, my strong interest in how disease affects the human body led me to study a degree in medical physiology. Learning the drug interactions with cells and nerves fascinated me, and this knowledge has given me a solid foundation to study dentistry. I've performed experiments requiring precision, accuracy, and manual dexterity, such as the stimulation of frog sciatic nerves in studying action potentials. Researching the trigeminal nerve reinforced my interest in dentistry, as I learned how local anesthetics work, and this related to my observation during my work experience of the dentist targeting the inferior alveolar nerve when injecting lidocaine. They really got up close and personal to see that. Okay, who are we starting with? Stuart.
Again, it's a decent paragraph. I would perhaps just think of the general structure. Again, this might just be a personal thing. I would try and get the sort of your academia earlier up. Personally, I would put this probably as your second paragraph. I think, I don't know, that's just how I've done it, and the people I've helped, they've tend to sort of structure it that way. But that's a point aside. I think the first one about learning autonomously, I think a GCSE award at ICT, I think there might be a better example somewhere in your sort of educational career. I think actually demonstrating sort of studying at university will probably show independent learning more than a GCSE award. So I don't know if I'm being a bit harsh, but hopefully if you can look back on their own sort of educational journey and maybe highlight a different point.
It seems to me like one of those where you just list everything you've ever done, or every achievement you've ever had, every swimming competition you won, and then you just try and fit it in there. Yeah,
because I don't know, I don't think, my personal opinion is that learning autonomously for a GCSE ICT award, I don't think that's going to make you stand out that much, to be honest. I know that sounds a little bit harsh, but I suppose that's why we're here, to give our opinions. But I think the rest of it's good. I think I think they've been more specific here. You can tell that they've studied a degree and enjoyed it, because they've been very specific about interaction with cells and nerves and things. I think if you're going to talk about local anesthetics, perhaps just drop a little line in about a very specific thing, because I think that would really highlight that you understand sort of the physiology and sort of the anatomy and how it works. I think that would put you above lots of other graduates if you started talking very specifically about local anesthetics and things. But generally an okay paragraph, I think.
All right. Score?
1.5.
1.5. Solid 1.5.
I know, it's your scale, mate. It needs to be 1 out of 5.
And Pam?
I thought the exact same as Stuart, because that first sentence, I really didn't like it, and I thought maybe I was being a bit harsh, but the fact that he said the same thing, I think I'm not being harsh. I think the truth is that, you know, when you're doing your GCSEs, they're really important, but then afterwards, no one really wants to, it's not as important, basically. And we know that you've tried really hard for it, like we did the same, but I wouldn't put it in personally. There's better ways that you can think of, you know, showing that you can learn independently, but I like the rest. I thought the rest was really specific, and I thought for once, oh, this person's actually done this, which I think, as me as a reader, if I've thought that means they've been specific in their content. So yeah.
Okay.
Yeah, definitely. Just a little heads up, Arnie, there's 10 minutes left on this meeting.
Okay. We'll be a bit quicker. So I've been involved in playing for a football team on a weekly basis, and this has allowed me to continue keeping fit whilst taking a break from my academic commitments. I'm also a student ambassador, and this has given me the opportunity to improve my oral presentation skills, as I have had to communicate with prospective students. I've contributed to the community through volunteering, and I've been heavily involved in providing healthcare through my job. As a proactive student, I have taken part in sports and represented my university as an ambassador, and I believe this would all benefit me in coping with the intensive dentistry program. My work experiences have allowed me to decide that dentistry is a profession which would utilize my potential for the good of the community in providing healthcare. Pav, how do you find this as a finishing set of paragraphs?
I like the paragraphs in general, but I don't know if it should be the last thing that you leave with the person, because this shows that they're a very good all-rounded person. Like, they've done volunteering, they're good at sports, you know, that they try and keep fit, and they've got the work experiences. I just think the last paragraph should be you bringing everything in together, which they kind of have done, to be fair to them. I just think structure-wise, maybe just, again, too wordy. Probably can be a little bit more specific. And, you know, that last sentence needs to be why you want to, like, do dentistry, I think, personally, for me. Like, leave it with the person that, whoever's reading it, that, oh, this person is serious. I think the fact that they mentioned the intensive dentistry program is probably a good thing, because maybe people don't realise it is quite a intensive degree. So I think that was good.
Okay. What would you give the score? Let's say the score for this section, and then your overall score for this draft of the personal statement.
Probably about, a 1 to 2. That's 1.5.
1.5.
I'll go for 1.5.
Okay.
Yeah. Overall, I'd give it a low 2.
Okay. And Stuart?
So my opinions on the last sphere, again, agree with Pav. I think your last few sentences should demonstrate how you are ready to start studying. You've done your work experience, you've done your first degree, so you're ready to sort of study, and then you're also ready to commit to the career in general. I think the sort of second to last paragraph, if you're going to talk about stuff outside academia, talk about your football, but then don't talk about being a student ambassador. Put that in a different section.
Okay.
It's two different thoughts. Just stick with the stuff outside. And yeah, just be more concise with the last paragraph, bring all the key points together, and just don't leave them with a question, just leave them with confidence that you can get an interview and be like, yeah, I'm ready to study dentistry because of this, this, and this. Yeah. General thoughts overall is that it's an okay personal statement. I don't think it's going to blow away anyone reading it if it was sent in like this. I think this is a decent first draft, but needs a reasonable amount of work just to take it up to the next level. Okay. So probably a 1.5.
1.5.
Okay.
So this sort of... Sorry?
I was going to say blame your scale. If it's out of 5, I'd give it
You got to take away the choice so that you're more, you know. Yeah. So, okay. So for whoever's been watching this so far, this type of personal statement wouldn't blow away Pav or Stuart. So at least it gives you a flavour and somewhere to start when you're writing your own, and the things to be involved in, the things not to be putting in there.